Joining us now is Andy Slavitt, the White House's senior advisor for COVID response. Mr. Slavitt, welcome back to the program. Good to see you again.
Good to see you, Joshua. Thanks for having me.
Before I ask you policy, I would just like to ask you a question as a dad. You revealed this week that one of your sons was dealing with symptoms from long-haul COVID. How's he doing now? Everything okay?
Yeah, I mean, look, he's basically fine. We just don't really know when these symptoms are going to go away, and I think he was surprised by it. He's an athlete. He's 19 years old, so you generally tend to think when you're an athlete, 19 years old, that bad things can't happen to you. And I think for a lot of what I think we learned is that for a lot of people who are younger who aren't that worried about COVID, they really should pay attention. It's not something you want to get. So thanks for asking.
Could I just ask you, for you as not just someone who works in the White House on this policy response, but also just as a dad, what were you thinking in terms of trying to make sure that he was well, dealing with symptoms, interpreting what he was going through? How did you think through that as a father?
I realized that as a parent, my go-to move is to tell him everything's going to be okay, and that I've seen this before. So when your kid comes to you with a problem, you want to show them from experience, and you want to reassure them. And what's hard here is that we don't know. If he says, "Dad, how long are these symptoms going to last?" I don't know the answer to that question, and it's not great as a parent to not know. And I think in the case with COVID-19, because it's so new, that's what happens. And I hear that from young people and their parents who have COVID-19. The uncertainty is part of the hard part.
I think all parents love their kids. All parents want to see their kids protected and safe and taken care of. I'm sure you do. All good parents do. I wonder how the experience with your son, and I'm glad he's doing all right, has informed the way you view policy with schools. We're hearing more parents very vociferously demanding that their schools go maskless by the fall, maybe even for summer school. Still some questions about whether children should be vaccinated and at what age. How has that affected the way you view the way we take care of kids, particularly in school settings?
Well, here's how I look at things. 12 to 15-year-olds can now get vaccinated, and we had just yesterday 250,000 teens and tweens got vaccinated. Over 1 million have so far. And over the course of the summer, that's going to mean these kids are going to be back to their normal lives, are going to be able to go to camp or whatever their summer activities are without having to wear a mask, and they're going to be able to go to school without masks. And I think that's great. If my child were younger than that and not able to get a vaccine, then I would have them consider wearing a mask until such time as they were able to get vaccinated, if I had particular reason to be concerned. Now, if the virus continues to drop as it's dropping and the risk goes down, then maybe that changes. Because remember, in January, everywhere you looked, there were people with COVID. As things get better and better, more people get vaccinated, and that might not be the case any longer, so I would feel much more comfortable.
How much does that impact what the CDC guidance on masks in schools will be like? I understand that there's going to be some more guidance coming out soon, but it almost feels like every time we talk about this, it's a moving target. It sort of depends on what the rest of us do that affects what the pandemic looks like at the time the CDC releases the guidance. It feels like the biggest variable in all of this is us.
You got that right. I mean, it's a moving equation. There's two things we can do. One is get vaccinated, and the other related thing is, if we're not vaccinated, do everything we can not to catch and spread the vaccine until we get vaccinated. So as we look at two pieces of data, and the CDC looks at two pieces of data. One is what's the vaccination rate in a community, and second is how many cases are there in a community. If you've got communities that have very high degrees of people vaccinated, and as a result, very low case counts, they're going to recommend, their guidance is very likely going to guide people that there's much they can do and probably should be doing and be able to do without a mask. But if you're in parts of the country, and there are parts of the country where you have very low vaccination rates, then I think it'll be a different story. There's going to be a risk, particularly come late summer, fall, that in those places there could be outbreaks again. And then I think everybody who's not vaccinated is going to want to be more careful. And of course, better for them to get vaccinated.
And for those parents who are saying, I love my kid, I want to keep my kids safe, that's why I'm concerned about them getting vaccinated. That's why I'm not sure I want them vaccinated. Or that's why I don't want them wearing a mask, because I'm concerned about what the health impacts of that could be. I know the science isn't there, but the love for their kids is still there. To parents who feel that way, that that's the way that they express their love, their concern for their kids, what would you say to them?
I love the way you asked that question, Joshua, because the parents are all we're all trying to do what's right and what's best for our kids based upon what we know, and so I think we got to refrain from judgment if people are making different decisions than we do. Now, if people had the privilege of being close to the vaccine studies and the trials and the science, they would conclude that the clinical trials that were done on 12 to 15-year-olds were just absolutely immaculate, very well tolerated, and of course 100% effective. So if you told me that there was a product that I would like and would be 100% effective, that's a great track record. So I think as more parents see that information, they will probably choose to get their kids vaccinated. Of course, in the meantime, there will be some that'll wait and see, that'll just want to know how it's working out. They'll want to talk to other people. That's, I think, just a natural way that different people make different types of decisions.
Many parents and caregivers, particularly women, were hit extremely hard by the pandemic. What's your sense of how the COVID response must calibrate itself, particularly for women who have been hit economically, especially hard by this pandemic?
Look, I think there are a lot of pieces to pick up as we hopefully continue to move out of this pandemic. I think there's been a lot of pain, a lot of different types of pain, emotional pain, financial pain, physical pain, and the pain of just not having your loved ones and your support system around you. And we should all be, I think, very tolerant of the fact that, as we come out of this, people are going to be reacting in very different ways. We believe that a great country puts a support system underneath people in tough times. That's why the American Rescue Plan, that's why the American Jobs Plan are so important, because they essentially say, hey, we will help you get back on your feet. We will help put out the handout, not the handout, but the hand up, so you can get up on your feet as you want and get your life back together, whether you have a small business, whether you're a single mom with kids, whatever your situation. And we should not be judging whose pain is worse than someone else's. We should really be helping one another.
What about the trajectory of vaccinations? I have to say that seeing some places doing lotteries and offering money for people to get a vaccine that people in some parts of the world are literally dying to take, I don't know what to make of that exactly. Like, are we reaching the top of the curve when it comes to everybody who's going to voluntarily get vaccinated, or do you see prospects for vaccinations to pick up again?
I'll tell you how I think about that question, because it's a good observation. My sense is that there are many people in this country who believe in vaccinations that haven't yet had their COVID vaccine. We've got 97, 98% of people take their measles vaccines, and so we're at about 60% of adults now who've taken their COVID vaccine. So it's not that they don't believe in vaccines, it's just that it's not a super high priority. They don't necessarily think COVID is a great threat. They don't think that what happened with my son is likely to happen to them. And so they just are waiting. And that's why things like these lotteries are so important. You may have seen today that some of the dating apps, I can't name them all because they all have names that I don't understand, but they all came out with, 9 of them came out with something which they're going to allow people to identify their status and search for people who are vaccinated. And in fact, one of the sites has reported that people who are vaccinated are 14% more likely to get a match. So people have got to see this as it allows them to do the things in their life that they want to do. Whether it's win a lottery, I don't know. Whether it's socialize again. Those are the things that motivate people. Most people don't spend all their lives thinking about the vaccine, and those are people we have to reach.
I wonder if that's part of the key of it, Mr. Slavitt, is talking about the vaccine in terms of what it will allow you to do, as opposed to just like, we have to fight the virus. Getting vaccinated allows you to get a date, or getting vaccinated allows you to get back to business and start making money again, or it allows you to know for sure that you're doing everything you can to keep your children safe, that this is about something bigger than just a shot in your arm. This is about everything in your life that's important in one way or another.
I think that's exactly right. Whether that's hugging your grandmother, whether that's playing with your friends, whether that's going out on a date, whether that's just having people over, the things in our lives that we've missed over the last year are the things that should be motivating us to take the steps to get back there. And I do completely agree with you that it is that vision that will bring more people to get vaccinated and getting their questions answered, because many people have continued questions about the vaccines. They deserve straight answers to those questions, and we'll get them to them.
And before I let you go, you've said that you're going to be leaving this post at the White House early next month. How do you reflect on your time there so far, and have you thought about what your next move is going to be?
Well, it's been a great honor and a great pleasure and privilege to serve here. I'm certainly going to miss being here every day. I'm grateful that the people that are still going to be here carrying on the mission are exactly the right people to be doing that. So I'm going to miss the work because it's incredibly meaningful, but I'm so encouraged. I wouldn't rather have anybody that I could think of here fighting that out for us. So I'm looking forward to getting back and seeing my wife again, because we've been apart for about 4.5 months, and that'll happen soon.
And what's next for you?
Well, we'll be talking about that later. I have a book coming out that I'll be talking about in the next few weeks, but mostly looking forward to seeing my family again.
Well, hopefully we'll have you back to talk about that or whatever your next move is. But for now, Andy Slavitt, the White House's senior advisor for COVID response. Good to see you again. Thanks very much.